So moving right along, next up would be, we're going to discuss caring for the elderly population. And we have several speakers for this. So Ms. James, you out here? Oh, okay. So I'm going to start off with her and let her tell me exactly the order in which she'd like to have everyone else talk. What we're going to do is it's going to be like a 5 or 10 minute discussion on each point. What we're looking to try to do is find out resources that are available, and although I mean, this may apply to you, may not apply to you, may apply to a family member. The whole point of this is so you understand the points that are important, to know what's available out there, what's the legality of I mean, having somebody look out for your best interest from a standpoint of health care decisions. And you need to know what it impacts, when these power of attorneys are good, no good, what do they really mean? What are the resources available that allow you the opportunity to get out and enjoy life, but at the same time be protected, so you can have assistance if you need to. So without further ado, the first speaker will be Iris James, who's with Senior Services.
Good afternoon. I'm Iris James, Community Outreach Representative for Senior Services of Southeastern Virginia, where we help seniors to live with choice and dignity in their community. In addition, we work with their families, their caregivers, and anyone in their church, their neighborhood, their civic group. It doesn't matter. We want them to be healthy and happy where they are. So we have with us today several individuals who are going to give you little snippets of information that will give you some resource options for yourself as a senior, for your family members, and anyone in your community. We have individuals who are going to talk about some legal aspects, some caregiving aspects, and show of hands, who has done their advanced care directive? Put them up. So Ms. Shamika is going to have a little bit of work to do to convince everybody that anyone 18 or older needs to have that document in hand. I'm here representing Senior Services of Southeastern Virginia, which is the area agency on aging. We serve seniors 60 and older. We provide transportation services. Who's seen our iRide buses on the street? Anyone had an opportunity to use those or use them for their family members? Show of hands. Okay, so I have flyers out front. I've had many inquiries today regarding our transportation services. This is not HandyRide, but you just pick up the telephone, you call our offices, and you talk to a transportation counselor. They can get you registered, and then you call back when you have a physician's appointment, any medical appointment in Southampton Roads, and in Western Tidewater our services act a little bit differently. But if you call our office, the transportation counselor can try to help you to get to your medical appointments. Doesn't matter whether it's chemotherapy, a regular physician appointment, it could be dental or eye, or even for dialysis. So give us a call for transportation. Who's familiar with Meals on Wheels? So we are a part of the National Meals on Wheels program, but our program that we have that operates out of our office is a little different. We have the Home Delivered Meals program, and so our options counselors can work with individuals who may be homebound, who may be having a problem cooking, or sometimes people just need temporary assistance to make sure that they're getting nutritious meals in their home or in their location. Even sometimes if you're staying in a family member's home, it may be beneficial to have these meals delivered. So we also have wellness programs, exercise, our new enhanced fitness program, which is done throughout the community. Sometimes in churches, our Matter of Balance program, sometimes we bring them to the churches or community centers so that people can work out and learn about health and nutrition where they are on a regular basis. Socialization is very important, and it doesn't mean going to a senior center and sitting and playing dominoes and bingo all day. There are other activities out there that we can participate in. We have a lot of active older adults that we work with in the communities, and we want to provide programs and services for them. Nursing home care, home health aides, home health care companies, we are the resource to help individuals and families connect to these services. So we don't have all of the programs and services in-house. Many of the services that we provide have no charge attached to them. We can do that because we get some funding from the federal government through the Older Americans Act, through the state, through the Department of Aging and Rehab Services, and also from local corporations or foundations and individuals such as ourselves. So we gladly accept donations at any time so that we can help those seniors who may be less fortunate to get some of the services that they desperately need in their home. We can connect you to resources such as Social Services Department, and what about Medicare and Medicaid? And who knows when open enrollment is this year? Anybody? Show of hands. Open enrollment. What are the dates? Shout it out. October until when? Very good. So stay aware of that fact. Don't let the dates pass you by. We have benefit counselors on staff at no cost. They are not insurance agents who can assist those individuals with Medicare, no matter your age, with Medicare to get through that Medicare maze, to review your drug plan, to make sure that the dollars that you are spending on health care are benefiting you, and that you're not just paying for services or paying for medications that you either don't need or paying a higher cost than what you have to pay. Yes. We are located in Norfolk in the old Koger Executive Center, now known as the Interstate Commerce Center. That place is right off of Newtown Road and Kempsville Road, about 2 blocks from Centera Lee Hospital. That is our main office, but we have satellite offices throughout Southampton Roads and Western Tidewater. We go from the ocean, from the Atlantic Ocean, all the way out to the Emporia line. So we're available. It's one number. Make that phone call, call us, talk about any resources that you think you or a family member or someone in your community may need. We are open to have those discussions. Other questions?
What is that telephone number?
That phone number is 757-461-9481. And if you can't remember that, some people in here will remember with the old CVAM office, it's the same program. The number hasn't changed, 757-461-9481. All of our brochures have that number on the back. And once I come out and talk to a group of individuals about who we are, where we're located, and what services we have, you are now considered ambassadors for Senior Services of Southeastern Virginia. Pick up a brochure, keep it in your pocket, put it in your purse, and then whenever you're having a conversation with someone who's having a problem with their Medicare, getting their medications, a senior or someone in the family who needs to get connected to Alzheimer's Association or even to a physician's program, physician's office, you can give us a phone call. We have people, our resource counselors, who are available to have that conversation with you.
And Ms. James will be here for the duration. Okay, so we want to thank her for coming out, spend a couple of minutes describing the senior services, and we want to go ahead and keep moving, but she will be here, so I want to make sure you know she has resources out in the front in the expo area, so that if you want to grab something on your way out or to go out there and just have a conversation with her, she'll be out there to receive you all. So thank you very much for that.